we're going to go ahead and get started. So welcome, folks. Really happy to have you guys here today. Happy Friday. We made it through another week. It's been a rough week, as I feel like is the usual, just with hate crimes and the ways we continue to see white supremacy manifest in our society. And so I just hope that you guys are all taking time to care for yourselves and taking time to recharge, because I know that this has been a draining week, draining time. So we appreciate you guys. We're glad to have you here, and we hope that you'll have a wonderful weekend. But the webinar is not over, so don't check out to your weekend yet. So our logistics for today are the same as always. So if you have any questions, please use the chat. We love to hear from you guys, so please do take time to type into the chat and ask your questions. You can always unmute yourself and ask a question if it's in the appropriate space. We are going to have a really interactive portion today, so we would love for people to unmute. So just start mentally preparing yourselves to verbally engage with us or to engage with us in the chat. We really would love to talk to you folks about that today. To you folks about things. I didn't say what things, about the housing choice vouchers. So anyways, but when you're not actively speaking or actively asking a question, we do ask that you keep yourself on mute, just so we can minimize background noise. If you accidentally unmute yourself and there's some background noise, I'll go ahead and mute you, and just know that it's not meant to give offense. It's just so that we can make sure we can hear our presenters and that there's no competing noises. And then we say this every week, and I do hope that you know that it is heartfelt, that we appreciate you guys so much. We want to make this space to be here with you guys, to share resources, to check in, to see what's needed. We really value the work you're doing, and we just want you to know that we appreciate you. It's been a long year. It's been an exhausting week. Pandemic, white supremacy, all the things mixed together are a hard cocktail. So please know that you are appreciated and you're valued, and we're really glad that you're here. And so with that, our plan for today is to talk about a lot of the same kinds of umbrellas of topics. So we're going to have some shelter updates. Then we're going to hear from the health department, and they're going to give us some updates, which we're excited about. Then we're going to talk about a number of system updates, including having an interactive portion to talk about the surge in housing choice voucher pulls that we've experienced lately. And then we're going to end with some resources for you all. And so with that, let's go ahead and get going. So many of you may be aware, Lauren Licata is out sick right now, unfortunately. So we're sending her our best wishes for healing. But while she is out, I'm going to go ahead and give the shelter updates. I know I'm not Lauren's spunky self, so I won't even try to match her lovely energy, but I will share with you what information I have. So as always, we want to give you a little information about alternative shelter, the alternative shelters and the usage. So right now we have no clients in type 1 shelter, which is the space for symptomatic clients who are awaiting a test. We do have 5 clients in type 2 shelter, which is where folks go when they have a positive test result. And so this is a bit of an increase from last time. We were at 0 for both last time, but still fairly low numbers that we've been able to maintain as a system. So we thank you guys for your ongoing vigilance to keep social distancing up, keep clients safe. We also are excited about the ongoing efforts related to the vaccines. And so as of yesterday, we have vaccinated 24 facilities, including 2 project-based voucher sites. So that's really exciting. We continue to increase our reach for vaccines, and we've distributed over 1,900 vaccines. Now that's to both clients and staff, but that's still almost 2,000 vaccines to persons who engage with our system. So that's really exciting. And the health department is continuing to schedule vaccine appointments and is continuing to work to continue to get those numbers up. So really grateful for the health department's partnership on this, grateful for all of you guys helping to get yourselves vaccinated and get clients vaccinated. Exciting to see these numbers continue to go up. And so then this one is just a brief reminder, you've seen this slide a number of times, that as clients are getting vaccinated, please do work with them to complete the ROI so that their vaccination data can be added to HMIS. You'll make a copy of both the vaccination card and the ROI, and then you'll email those to Lauren. And the link to the ROI is here on the slide. And let me just see. I should be able to paste in the chat for you all as well. Okay, here we go. All right, here's the link to the ROI, and it's in the slide as well. All right, and then the last shelter update that we have is we just want to make sure, I'm sure all of you know this, but just a reminder that the warming center is closed on March 31st, which is right around the corner. So we just want to make sure that we just want to make sure that this is on your radar and that you're working with clients to find alternative housing arrangements. Again, we know you are, but just a reminder to do so. And just another reminder that if clients in your warming center don't have a permanent housing destination or won't have one by March 31st, just make sure you're partnering with CAM on this. Make sure to let CAM know now so that they can start to plan for an alternative shelter placement for clients. And just remember that this is a stressful time for clients kind of having transitioned their place that they're living is in limbo. And so we've heard from a couple of clients feeling really anxious about this, reaching out to us. And I know you're engaging with clients who are anxious too. So we just ask that continue to meet clients where they're at, to let them know that they will, no matter what, we'll find a place for them to stay, that they won't be put back out on the streets, that they don't, you know, that we're definitely going to take care of them in this time. So we just want to make sure to communicate that with clients so that kind of the stressful time of transition doesn't have to feel so overwhelming for them. And so with that, I'm going to turn it over now to the health department to talk about some updates. And I believe they have some slides, so I'm going to stop sharing my screen so that they can share theirs. I believe it's Hannah, right?
Yes, good morning. Let me just share my screen really quick.
Wonderful.
Oh, I still have my fun space background on from yesterday.
I like it.
Adds a little bit of fun into the day. All right, can you guys see this now?
Yes.
All right. Good morning. My name is Hannah Ewing. I am filling in for the wonderful Japari Gadzama. I'm one of her fellow outreach nurses. I focus more on our youth and our school-based outreach, but I do a lot of our vaccine work in the community as well. So we work together all as a big team, and it's a pleasure talking to you guys this morning. So I'm going to give you a little bit of an update on the situation of COVID in the city of Detroit. We've had over 30,000 confirmed cases with 1,856 confirmed deaths. If you look at our positivity rate, the city of Detroit is doing better than our outerlying communities like Macomb County, Oakland County, and Wayne County. So this means that we're doing a really good job taking care of one another, continuing to wear our masks, social distance, getting vaccinated, and practicing good hand hygiene. However, we have seen a little bit of a bump. So just as things open up, it's important to remind people to stay aware and make sure that they're still following those safety guidelines. We also see an overall COVID positivity rate of about 5% in the state of Michigan. So overall, though, Detroit is doing very well and taking care of the community. We wanted to put a plug in for our free COVID testing. If you need anyone that is interested in testing, it's still important, even though we roll out the vaccine currently, that we still monitor what's happening with COVID, because without this data from testing, we have no idea what the situation of COVID is actually like in our community. So for an appointment, call 313-230-0505 and say that you want to get COVID tested. They're doing testing at the Joseph Walker Williams Community Center and at a couple other sites throughout the city. And then there's additional sites. If you don't want to go to that one, you can visit the website www.michigan.gov/coronavirus test or call the number 888-535-6136 and press 1. And remember that it's important to quarantine while you wait to receive your test results, because we want to make sure that no one is spreading COVID and out in the community while they may come back positive a day or two later. If you have any questions too, or you don't want to call this number to get a COVID test, you can always email us at dhdOutbreak@Detroitmi.gov, and we're happy to answer any of your questions you have. We have our updated vaccination eligibility as of St. Patrick's Day, March 17th, 2021. As always, there is no cost for the vaccine. We have opened it up to any resident of the city of Detroit who is age 50 plus. That means anyone born in 1970 or earlier. We've also opened it up to include manufacturing employees that live or work in Detroit, our child care providers and K-12 school employees, our adult foster center caregivers, our U.S. Postal Office employees who live or work in the city, as well as employees of the city of Detroit who are in face-to-face contact at their job sites, all food and beverage workers living or working in the city, our federal, state law enforcement officials who live or work in Detroit, our funeral home and mortuary service employees who live or work in Detroit, our active members of the clergy who are in face-to-face contact with their congregation members, our security guards and janitors who keep our city safe, anyone who falls in that 1A population, meaning that they usually are in a healthcare setting, they can be paid or unpaid, and any Detroit resident with intellectual and developmental disabilities, and the caregiver of that resident and a home healthcare provider if they travel in the same vehicle during the appointment. It's important to note that if you have multiple caregivers for one person at this time, only one person is eligible. So a good method to that is that if one caregiver is over 50, have that person get vaccinated, and then have a person who would not normally be eligible for the vaccine be that that formal caregiver that you're making the appointment with. When you call the TCF center, if you are bringing two people in one car, make sure that you're making the appointment at the same time so that we can prepare both vaccines at the same time. So how to make an appointment, you're going to call the number 313-230-0505. That's the same number for testing, and the line is open between 9 a.m. and 6 p.m. You're going to choose prompt 1, which is the vaccine option. And during this time, they may ask you for a couple of questions like your name, address, date of birth, phone number, email. I will say that we will never ask for any information like a credit card number or a social security number. So if someone asks you for that, that is not the TCF center, and they're just fishing for information. Additionally, if you fall into one of those essential work categories, they may ask you to provide your essential work type, your work employer name, your work address, and when you get your vaccine, they may ask for proof of employment, such as a work badge or a pay stub. When you make your appointment at the TCF center, you'll be given an appointment for 2 different vaccine dates, so you don't have to worry about scheduling that second dose. And then they will also follow up with any emails and reminders via text and or email. This is what to expect on day of appointment. So try to show up on time. I know I always like to run a little bit early, but we ask that you come on time just so things flow really well and we don't end up with too many people coming early, which can overwhelm the system. Also, try not to be late as you may miss your appointment slot. When you arrive, bring your ID or a piece of paper that has your date of birth and your full legal name. And then you may be asked to show your work stub or your work pay stub or your work ID. And then any members, including yourself, need to be masked in the car at all times. When you arrive too, your ID will be verified at check-in. You will be asked if you have any allergies, say you've had a history of anaphylaxis or when your throat closes up to any medication. The nurses and doctors and medical professionals on staff like to know this ahead of time to make sure that they can watch you for an extra 15 minutes. So you'll be waiting for 30 minutes instead of the normal 15 minutes. Having a history of anaphylaxis is not a contraindication for the vaccine. So just let them know and they will make sure that you're kept safe during your appointment. Also provide clothing that is easy to access. So we know as it warms up, it's going to be a little bit easier, but on those colder days when you're wearing a jacket for your appointment, just make sure you have a short sleeve shirt or a tank top underneath so that the provider can easily access your vaccine injection site. And the TCF Center is open 8 a.m. to 6 p.m. We've also opened our vaccination efforts into the community and also into Senior Saturdays. So we have 8 different locations where our age 50 plus can get their vaccine. The appointment process is the same. You're going to call that number 313-230-0505 Monday through Friday, 9 a.m. to 6 p.m. to schedule. If you have a preferred location, you are welcome to ask for that. Say you live close to Community Recreation Center in Southwest Detroit, you can ask for that. Or if you don't know which one you live next to, just give them your address and they will get the closest site for you so you have the shortest distance to travel. And then this is our COVID-19 dashboard. It shows how many vaccines we've given and where we are going. So as of a couple of days ago, we've administered over 146,000 shots, which is about 76.6% of our total supply we've received. You'll notice that as the week progresses, this number increases closer to 100%. We also have over 50,000 future doses scheduled, and we've given about 145,000 of the Moderna and then 45,000 of the Pfizer vaccine. We've also increased our data transparency to show who we are giving these vaccinations to. We've vaccinated over 12,000 grocery store workers, over almost 12,000 K-12 school employees, and then lots of other different groups in the community as well. We've also broken down this data into racial and ethnic data so that we can see and make sure that we're equally distributing the vaccine across the city. And then we've also started our COVID-19 Power Hour, where this is every Monday through Friday from 4 to 5 p.m. You can call us at the health department and talk to one of our health communication specialists or registered nurses on site. You can ask us any question. Say you have a question before you get vaccinated, just let us know and we're happy to answer that. Additionally, if you're having any side effects, you can also call this line and we will help work through this and make sure that you get the right attention or the peace of mind that you need during this process. That number is 312-626-6799 and the meeting ID is 848-7714-7801. And there's also a Spanish speaker most of the time on that line, so it's a bit bilingual line. And that's every Monday through Friday from 4 to 5 p.m. As always, we are offering free face masks to the community. Call the number 313-876-4000, press 1. Or if you're more comfortable emailing us, you can always reach us at DHDoutbreak@Detroitmi.gov. That email is also the same that you would schedule any education sessions about the vaccine or answer any questions that you don't want to ask us on the live line that I just mentioned. We have our additional resources. You can also call the hotline 313-876-4000. And there's that email address again. And our website is always being updated with the most recent vaccine eligibility at www.Detroitmi.gov/coronavirus. And that's our update for the week.
Wonderful. Thank you, Hannah. I'm not seeing any questions come in, but if folks have questions, feel free to type them in the chat. And if we get any other questions, we can always reach back out to folks at the health department too. But thank you so much for giving us updates.
Of course.
Happy to have you here. We really appreciate you guys coming back and continuing to give us updates at these webinars. So thank you a lot for that. All right, let me just get situated here and we can keep on going. All right. So now we're going to transition to our system updates. And so with that, I'm going to turn it over to Amanda, and she's going to talk to us a little bit about the United Way grant, which is coming to a close soon.
Thanks, Katie. Yeah, good morning, everyone. So I will make this real quick. We have talked about this before for the past couple of weeks. This is just a reminder that we do have some very limited funding. That's even more limited now that we are coming to the end of this grant, but some very limited funding for furniture assistance or landlord incentives for people in permanent supportive housing. I should clarify, for people moving into permanent supportive housing or rapid rehousing. This is really targeted to people who are in the process of moving into a unit, or perhaps they have just recently moved in and they don't have any furniture yet. Details are on HAND's website, which is linked there. I'll also drop that in the chat box. So the one thing to note is that we are getting to the end of this assistance. The funds are only available until the end of this month or until they are exhausted, whichever comes first. And folks have been taking advantage of this opportunity, which is exciting. So we are getting close to the end of having funds available, even though we have, about a week and a half left in the month. I can't guarantee that the funds will last that long. So if you do have a client who has recently moved into a unit through PSH or rapid rehousing and they are in need of furniture, please do get that request in soon so we can address it. And I will, like I said, I'll put that link to our website in the chat, and all of the instructions you need are there on our website. So, thanks all. I'll turn it back to you, Katie.
Lovely. Thank you, Amanda. All right, and now I'm going to turn it over to William, I believe, to talk to us about some HMIS updates, or it might be Vicki.
Yeah, it's Vicki.
Hey, Vicki.
Hi. Good morning, everybody. I'm Vicki DeMars, and I'm one of the HMIS system administrators for HAND. I just have a few brief updates to provide you. The first one is that we do have an opening for a COVID-19 vaccination data entry clerk coordinator. It's a full-time, one-year term limited position. The individual would be responsible for maintaining the data and coordinating with clients and community partners to maximize the efforts of providing clients with full recommended doses of the COVID-19 vaccination. We have extended the deadline for the position and are hoping to get it filled as soon as possible. So if you're looking for more information, you can refer to the position description on the HAND website. It is posted under the Employment Opportunities section of the HAND website, and the link in the slide is the direct link to that position description. The second topic I wanted to touch on was our HAND 2021 virtual HMIS bootcamp. As many of you may know, we held a 2-day virtual boot camp at the end of February. The training event covered a wide variety of topics, which included a number of HMIS related informational sessions and specific data entry workflows for the City of Detroit ESG funded programs. We received a remarkable turnout for the event. We were thrilled about that. And we ask that anyone who did attend, please complete the evaluation form. This is very important as it gives us some insight as to what was successful or what we need to improve on for future events. We also want to gain some insight on desired trainings moving forward. So if you can please complete that evaluation form, greatly appreciated. All the session recordings, resources, and the link to the training evaluation form are all available on our bootcamp webpage. Again, at the handdetroit.org website /HMIS-bootcamp-2021. So you can review all that information there and access the link to the evaluation. And then the final item to touch on this morning is the PIT and HIC, the status of the PIT and HIC. PIT and HIC one-on-one meetings are underway. Most of them, I believe, have been completed up to this point, but there are a few that are remaining. Microsoft Teams meeting links were sent out via email. So if you not had your meeting yet, you make sure to share your meeting link with the staff, any staff that need to attend. Make sure your data cleanup assignments are completed within the assigned data deadline, and contact Kiana at handdetroit.org if you have any questions or need more information. And that's all the updates we have for today.
Wonderful. Thank you so much, Vicki. We appreciate it.
No problem.
I see a question coming in from Jean about the vaccines. I'm just trying to see. Hannah is still on the line. Hannah, are you able to answer Jean's question? Will a teacher or social worker living outside Detroit but working in Detroit be eligible for the vaccine at TC?
Absolutely. They may send you to the Coleman Young Center, but you are still eligible if you live or work in the city of Detroit. So you are eligible.
Wonderful. Thank you.
Of course.
Okay. So now we're going to move to, I was going to say the meat of our presentation, but that feels like a weird thing to say. So we're going to move to the bulk of our presentation, which is managing the surge in HCV pulse. So we're going to start just with a little bit of stage setting. I'm going to turn it over first to Catherine. She's going to talk to us a little bit about the numbers and what's been going on, give us a little bit of data on things. And then I'm going to turn it over to Amanda, and she's going to talk to us a little bit more about our goal as a system and some things coming up. And then we're going to jump into a collective conversation with you all about this. Okay, so first I will turn it over to Catherine.
Thanks, Katie. Good morning, everybody. This is Catherine DeStrath, the CAM manager. So as Katie mentioned, there's been a ton of HCV pulls recently. So MISHDA has pulled all of the households from the HCV waitlist and is going to continue pulling more as more households are added. So this is super exciting and means that most households in our system will have access to a long-term housing subsidy if they can make it through this HCV process. So this is definitely going to be like a all hands on deck sort of situation to assist people with the necessary paperwork and locating suitable units. So if you're working with clients who do not have access to their vital docs right now, so like don't have a birth certificate, ID, social security card, that sort of thing, just make sure you start working with them now to obtain those items. If they've been pulled already, they definitely need them ASAP. If they haven't been pulled yet and they're just being added to the wait list now, they're gonna need them very quickly. So that's really important. Those documents are gonna be super important to start gathering. Let's see, also the rapid rehousing street outreach teams and CAM navigators are working on completing pre-applications with people who fell off of the list previously or haven't yet been added in order to repopulate the wait list. So that's what we're talking about when more people will be pulled shortly. It'll be people who either had fallen off the list because they didn't recertify or because they haven't yet been added in the first place. And then I know Katie's probably going to talk in more detail about this, but the MISHDA agents are going to meet next week with shelter and rapid rehousing providers to walk through the process that someone goes through once they're pulled from the wait list. So like including all the necessary paperwork that they need, the deadlines and everything. So please plan to attend that if you have clients who have been pulled, especially if you're a shelter or rapid rehousing provider. And I think that's all I've got for right now, Katie.
Perfect. Thank you, Catherine. We appreciate that. And to Catherine's point about the meeting, we will talk about it a little bit more, but also if folks have not received an invite to the meeting on Tuesday and feel like you should join, do send me an email and we can forward that invite on to you. So definitely want to make sure anyone who would like to attend and needs this information to move this work forward can come to Tuesday's meeting. And so with that, I'm going to turn it over to Amanda, and she's going to continue kind of setting the stage for us, and then we're going to jump into our conversation.
Yeah, thanks, Katie. Well, good morning again. This is Amanda with HAND. So just wanted to, like Katie said, sort of continue to set the stage. You see the numbers on the screen in front of you in terms of the volume of folks who have been pulled. And Lindsay did clarify in the chat box, and appreciate that when we're talking about the homeless preference waitlist, when we're talking about these polls. So as you can see on the screens, we've had just over 380 people that have been pulled just in the last 3 months, and then almost 800 people in the last 6 months. So really significant. It is really exciting. Very exciting that these permanent housing subsidies are available in our community. And our goal as a system is to successfully get all of these clients who have been pulled leased up with this HCV voucher. We know that for many of these clients, they're on a rapid rehousing program or currently in the shelter or unsheltered, and so they do not currently have access to a long-term subsidy. We know rapid rehousing is temporary, even though some of the time frame that people can get rapid rehousing has been temporarily extended, but at the end of the day, that is a temporary subsidy. And so we are just really excited that we have this permanent housing subsidy available to these households to help keep them permanently housed, reduce their risk of falling back into homelessness, and just having them have a sustainable housing going forward. So our goal as a system is to see 100% success with people who have been pulled, and we acknowledge that that is not an easy win. We sometimes will talk about quote unquote swapping out a rapid rehousing subsidy with an HCV, as though it was a matter of filling out two pieces of paperwork and then boom, it's done. We recognize it is not that simple. It is can be a complex process. It can be fraught with a lot of steps and things that can go wrong along the way. And so that is really the purpose of our discussion today and the discussion on Tuesday, so that we can all work together for this to be successful. We really want to identify what are the things that are the potential pitfalls that we can see coming, that we can try to be more intentional about addressing up front, so that we can really just lay the groundwork to be successful. So we started some of these conversations with the Rapid Rehousing Work Group earlier this month, and again, continuing them at next week's meeting with the housing agents. And one thing I want to say too is that we know there's going to be some questions that are going to probably come up over the course of still this conversation this morning and next week. And if we don't have answers to those questions, we will do what we can to get answers, just so that we can again all work together for this to be successful. So with that, I am going to turn it back over to Katie.
Wonderful, thank you. Sometimes I feel like we're newscasters when they're like, back to you. Anyways, all right, just a little morning levity for us. Okay, so now we want to focus on, this is a part that we're hoping to be interactive with you guys and really have a good conversation. So one of the things that we have planned for the meeting on Tuesday is we really want to have time for a robust question and answer portion with the housing agents. We've got all the housing agents coming together in one place. We're really excited about that. As many of you know, it's difficult to get them to all come together in one place. So we're grateful that they are all going to be together in one place, and we want to make sure that we use that time with them wisely. And so we'd like to do a guided Q&A portion. So what we were hoping to do was use some time today to talk with you guys about what your questions are, what kinds of things you want or need answered from the housing agents to continue to move this work forward. And so to kind of kick our conversation off, we've included on this slide, this is what we've heard from you all so far. The questions that are on this slide are questions we've heard in different settings with all of you guys that are lingering and we'd like to see addressed by the housing providers. So I'm going to read these off, and I'm hoping as I go through these that it'll start to trigger other questions you may have. And so what I'd like to do after I read these off, so just if you can start thinking about it now, is I'd love for you to then chime in with other questions that you have. You can either do that once I finish reading these to unmute yourself and speak your question aloud, or to type your questions in the chat box. I'm going to take all of those questions and record them in a document And then a team of us is going to meet a little bit later today. We're going to take all of those questions and try to consolidate them, and we're going to share them with the housing agents in advance to let them know, hey, these are all the questions we've got coming from the community, and this is some of what we'd like to talk about on Tuesday. So with that then, these are the questions we've heard from you guys to date. So what is the process for a client to appeal on a denial? I see there's a typo there. For a client to appeal on a denial. And so then a sub question to that is, are there denials that are unable to be appealed? And what is the process that we need to follow as providers to help a client have a successful appeal? And then we also wanted to ask why the City of Detroit ID is not accepted as a valid ID, whereas the Washtenaw ID is. We also wanted to ask, what are the alternative documents that are acceptable in verifying client identity in lieu of their ID card, Social Security card, birth certificate, recognizing that it's very difficult to get many of these documents. Asking, are there any considerations being taken into place to be more flexible in light of the ongoing pandemic? For instance, electronic signatures, timeline modifications, what documentation is considered acceptable, et cetera. And then what is needed from the CoC for the housing agents to be able to share a client's status in the process with their case manager? If an ROI is needed, is that per client, per agency? We're hoping they can help walk us through the process so we can make sure to get you guys that important information so you can know how a client is progressing through the process. So these are the questions we've heard from you guys, we've recorded, and we're hoping to talk about on Tuesday. What else do you guys have? We figure that this probably is only scratching the surface. So are there more questions that you guys have that you'd like to have answered? I will stop talking so that you can start talking. Rashandra, I see that you're unmuted. Did you have a question?
No, I was unmuted by accident. Sorry.
Oh, no, that's okay. I just wanted to make sure we got your question if you had it. All right, I see Leah asked a question in the chat, which is, should our shelter and outreach navigation staff be attending the HCV training Tuesday as well, or just those agency leaders who have been invited? Okay, and then Jasmine said, yes, they should. So perfect. Leah, if you want to email me who from your team needs to be invited, I can make sure to forward the calendar invite to all of you guys. Perfect. All right, other questions, folks? Surely we didn't capture all of your questions here, or if we did, kudos to us, but just want to make sure if you have other questions that we're answering them.
Hi folks, this is Jasmine Morgan from HAND. I kind of want to encourage you guys to think through some of the times that you have helped a client through the process, recognizing that there are multiple layers, multiple steps in that process. Think through when you had the most challenges. When did those challenges reoccur with the second client or the third client, or how you were able to navigate some of the challenges that you guys have had. I know that this list is not exhaustive to the things that you guys experience on a day-to-day, and because we have the agents and we will have their ear, I want to make sure that we are really communicating what some of our questions are, some of the challenges are, and even praise them for some of the things that they've done well. We've individually worked with different agents, RPI, CMA, sales, PCA. We've worked with them individually, but now we'll get a chance to talk with them as a collective to get more information. So dig deep and make sure that once we actually talk with these folks, that we have all of the information that we get. As we see, there are so many vouchers that have come in. And so we want to make sure that we are 100% in getting all these folks housed.
Yes, thank you, Jasmine. I appreciate that context. Jean, I saw that you had unmuted. Did you wanna share a question?
Katie, it looks like she wrote it in the box. And so Jean asks, denials at the end of the process for debt to other housing authorities is an issue. Can they get this information to providers earlier in the process?
Perfect. Thank you. Jean, anything else you have to add?
Jamie says, it is important to understand what documents a landlord will require. For example, at the Bell, housing agents require 2 paycheck stubs, but the property manager requires 6 consecutive paycheck stubs. Jamie, how would this be a question for the housing agent?
It's not a question for them. It was just a statement, just to let everybody know that, like, as they're preparing this process, to try to help clients get leased up, that they might want to talk to the landlord and the housing agent before they go and follow up with getting documents, because oftentimes they'll get like what the housing agent needs, but then for compliance for the landlord, they'll need totally different documents. So it was more of a statement.
Oh, gotcha. Thank you.
Wonderful. Any other questions from folks?
Let's think about when clients are actually housed. What type of challenges from the agency are you guys finding with the housing agent? So I know that we have on here information in regard to learning if they're housed, learning where they are in the process, but even after they've identified the unit and they're moving into the unit, are there challenges that you guys are experiencing with regard to the housing agent and things with your clients? Okay, so that process is going great. Let's think through when we first get when a client walks into your office and they say, hey, I got information about, our clients will call it Section 8. I got my Section 8, I got my Section 8. Everybody understands what's next in that process after that client is standing at your desk saying that they got their Section 8 voucher? Are there questions that immediately come to your mind when your client walks in with very little information about what they're supposed to do next? Okay, Leah, I see yours. It will be helpful to have a listing of properties that accept HCVs. Okay, that could be asked, because those housing agents definitely work with an array of different landlords that they've worked with before. Thank you for that one, Leah. I know that some agencies have had one-offs with the housing agents, and you guys have learned some great things that would be applicable to the entire continuum. And so in the interest of our clients, we want to make sure that all of our colleagues are given the same advantage in understanding what the process is like, is the reason that we have this meeting on Tuesday. So that we're able to move through this process and really streamline it for our clients. And so even if you think that it's a question that you and your agency have already asked, it also might be helpful to share that kind of question with the group so that it can also be asked. And so Jamie over at NSO, I know you guys have regular meetings, and then you also have some one-offs that you've had. And then I also know Neighborhood Legal has also had some conversations with housing agents. Are there other agencies that have been able to convene with agents and found new information or questions that you had before that have now been answered?
Jasmine?
Yes.
Yes, we have recently had meetings with CMA, and I don't know, Robin may want to articulate on this a little more, but it was discovered that it was a good thing to have our list of clients that they're supposed to be serving.
Mm-hmm.
We inform them of who the case manager here is.
Mm-hmm.
So we're beginning to do that with them, and we'd like to know if that's something that can happen with the other agents.
Okay. Just having the information of them being able to provide the status.
The one-on-one,
they-
yeah, being able to know
they
who
have
to
been
go
doing-
directly to.
What they have been doing is updating the case managers regarding the clients that they're working
Gotcha.
directly with.
Okay.
We sent them a list of all the referrals, all the HCP pulls from their agency, along with the case managers' names.
Okay.
And so what they've been doing is emailing the case managers on a regular, the updates as they get them.
Okay. So that would be something that we would ask if all the other ones would be able to do.
Exactly.
Okay.
And they also informed us that in lieu of having the Social Security card, if they don't have it, that they're willing to accept a printout from Department of Human Services with a listing of all the Social Security numbers for that household. So it would be appreciated if the other agencies would accept that document as well.
Okay.
Yeah, which housing agent was it that said they'd
This was CMA.
CMA? Okay, thank you.
Is your agency providing them that DHS document, or is the client having it themselves? How are you guys obtaining that?
We're asking the client to get it for us.
And they've had success with getting that from their worker?
Yes.
Okay. Lauren put in the chat, I could see that being extremely helpful. Case manager updates plus MDHHS Social Security printouts. Donna, it also would be beneficial for clients and staff to have an understanding of the process of requesting extensions in the event clients are unable to locate a unit within the time frame allowed. That's an awesome one, Donna. Absolutely, especially in the times now with our COVID lives, trying to navigate being able to actually view the unit safely.
Wonderful, guys. These are great questions. I've recorded all of them. Thank you.
Are there any shelter folks that are on the line that have questions or concerns when it comes to managing the load and the communication inside of the shelters? Sure. I asked for the staff that is in the shelters. I'm sorry, Charles. Yes, I can repeat the question. For the folks that are inside of the shelters and working in our shelter system, do you have specific questions on the process? So typically, this process goes through our rapid rehousing providers, and we recognize that it could be a new process for folks in the shelter. So wondering if you have any questions specifically that would apply to your shelter operations and how to navigate through the HCV process. Awesome, I'm glad, thank you.
Jasmine,
Yes.
can we talk a little bit about rent reasonableness for HCV vouchers and getting clients into safe, decent, nice units instead of directing, perhaps that can be an issue when it comes to when they transfer from rapid rehousing to their voucher. And the time frame that we have. If we put someone into a property that does not meet the rent reasonableness of the housing agent, the MISHDA information, sometimes they have to take that, due that landlord down a little more. So there's this thing called Go Section 8 that MISHDA uses that we don't have access to.
Okay, so we need to figure out how you guys get access to Go Section 8.
Does anybody understand what I'm talking about? Nobody?
We got a stale crowd today. Listen, I am hopeful that considering we're getting some really good information here, it looks like a few folks are aware of the Go Section 8. So we'll look into more of the Go Section 8. And your question would be how you guys are able to gain access to that? To the
same tool that the housing agents are using so that we're on the same page.
In regard to the unit itself, right?
And in regards to the rent reasonableness of properties that they're, the tool that they're using, so that it may be a few dollars off, but based on their regulations, they may have to ask that landlord to take a cut.
Understandable.
And some landlords may not be willing to.
Understandable.
So, Jean, sorry, this is Amanda, just maybe clarify, are you finding then, I mean, when you've done the rent, calculations on the rapid rehousing side, and you're saying that could be a significant difference then when they're doing it for HCV?
There can be a difference, and to eliminate even that problem of having to relocate that client, if that client is satisfied with that property, and they have a decent landlord. A lot of times the landlords will go down on their rates, especially if it's just a few dollars, but if it's something significant, we just want to be able to avoid that.
Okay, thanks.
Hi, Gail. I just put into the chat. Yes, we are very interested in your comments.
Okay, thanks. Well, first I wanted to just kind of, in regards to what Jean was saying, regards to properties, we're not a shelter provider, we're an outreach provider, but we also provide transitional support services, helping people get their furnishings, as well as doing wellness checks and grocery deliveries after they've moved in. And, we're finding a couple things that working with our clients is, one is, the locations, again, of where clients are being put and not giving them an opportunity to look at more than one apartment or new location. I've found that quite a few clients feel that they're shown one space and kind of put in the position like they have to take that place or they're not going to get additional help. I also have a concern, again, with the furniture issue and not having things set up in the apartment or in the location prior to when the client moves in. So oftentimes you have space for them to go and then they're sitting in an empty place for quite some time. And then just in addition, just the follow-up care to making sure that the client is receiving and understands what their rights and responsibilities are in their property, them not fully understanding what their obligations are. And then, just again, like the follow-up, I've seen quite a few people where they've gotten placed into housing, and then they've lost their housing because there hasn't been, you know, case management or whoever the person was supposed to follow up who hasn't followed up with that person. And in addition to that, I've also taken part in a couple of different things where, you know, the person has gone to sign the lease and there isn't anybody from the actual, it's just been that person with the property management company signing. And they're like, they have no idea what paperwork they're signing. They don't know what they're doing because their case manager isn't there with them, or nobody representing them is there with them. So I have some concerns about the process. I'm just throwing my 2 cents into this hat with everything that you guys are talking about, because we're dealing with a lot of these people on the front end, even before they get into the shelter and before they're even getting put into the housing process.
Amanda, I see you wanted to chime in. Also,
Yeah, it sort of also
just one prompt for folks to be thinking while Amanda addresses this. We'd also wanted to hear what you guys need from us. It looks like we're running out of time now, and so I want to honor everyone's time. So I'm just going to have this prompt on the screen while Amanda talks. If you have specific support you have in mind that you'd like from us as the system, type it in the chat and so we can capture it. But Amanda, go ahead and share your thoughts. Sorry.
Sure. Yeah, nope, that's fine. I mean, my comment was really aligned with what I was going to say on this screen anyway. And thank you, Gail, for sharing that. I think it is really helpful to hear the perspective from folks that are not necessarily a rapid rehousing provider. So I appreciate that. Wanted to make a comment regarding the need for follow-up care, and this ties into this kind of provider and system adaptation opportunity. So the first bullet on the screen there is more so meant to be a reminder. I don't know this is something we really talk about a lot with our rapid rehousing and really our PSH providers as well, for that matter, but that if you are a rapid rehousing, again, or a PSH, and you have a client who gets pulled for an HCV voucher and they get leased up with that voucher, you can still provide case management for that client. And really, based on some of the comments that have been made, I would really encourage you to do so. You can still keep them enrolled in your rapid rehousing program, keep them open at HMIS, continue to provide case management services. Really what's happening is that your rapid rehousing program would no longer be paying for the rental subsidy. The HCV is paying for the rental subsidy, but that does not mean that that person needs to be closed out of the rapid rehousing program. They can continue to receive the rapid rehousing services. And right now I'm speaking specifically about CoC funded rapid rehousing. I'm pretty sure this is the same for ESG funded rapid rehousing. I don't want to speak for the city, but I'm pretty sure it's the same. Really kind of the point being that you're going to have a different funding source, pay for the rental subsidy, the HCV. So your rapid rehousing program is no longer paying for the subsidy, but your rapid rehousing program can continue to pay for case management. And again, I think it would be really important to consider keeping those folks open in your rapid rehousing program, providing that case management so that you can, accompany the client to that lease signing, help them with the moving in. We know that furnishing apartments is extremely difficult. This little bit of furniture assistance that we've had has proven that and how quickly it's going. But if you continue to provide those case management services, that is a sort of a key thing to help make sure that client is stably housed, and so that they understand their own obligations on the HCV program. Rapid rehousing services will at some time end. And so you as a case manager can play a key role in helping them understand what's this paperwork that's going to be coming a year from now when I have to recertify. How do I understand my lease? What's my obligation? Who am I paying my rent to now? All of that is going to be really important to make sure folks are sustainably housed. So please, again, as a rapid rehousing provider, again, this would also apply to PSH, you don't have to close that person out of your rapid rehousing program. just because they get HCV. I'm sorry, that went a little bit long. And the same vein, if, again, as a CoC funded program, if as you're doing that, you're looking at your program budget and you're wondering, how can I make this work? My budget's not aligning with what I need. Just please come talk to me. We can talk about that one-on-one if we need to work with the field office to make modifications. Like, we can work through that. We really want to do what we can, again, to make this successful for everyone. So that's all I had.
Sorry, I was talking, but I was muted. So thank you, Amanda, for that. That was really helpful. We just have, we are at time. So what we had left here for this was we just wanted to hear from you guys about what you need from us as a system to support you in this. We don't want you to feel like you have to be out there navigating this alone. We want to kind of all rally together as a system to make sure that we can meet our goal of getting as many clients as possible to successfully have this long-term rental subsidy, which can really improve quality of life for them and help make sure that they can maintain stable housing permanently. And so, you know, we really do want to hear from you genuinely what you guys need. And so we've thrown out a couple of ideas of regular meetings, how frequently you'd like to meet with the system, with who, if you'd like it to be anyone who's engaging with clients who have been pulled for HCV, if you'd like to break it out by shelters and rapid rehousing providers, if you'd like us to meet one-on-one with each individual provider, if there are specific trainings and support that you guys need, if there's specific policy changes that you need for us to make sure that you can really be meeting clients' needs in this, or do what you need to do as an agency. We want to hear those things. And so I know that we are at time and I want to respect that. So if you guys have feedback, I would love to hear from you. I popped my email in the chat. And so I just want to say, please, I'll send it again one more time. Please email me and let me know what questions you have, what supports you'd like. We'll keep a record of all of those. And we have a meeting coming up on Monday with some systems leaders to try to plan for this. And so we really do want to hear from you. We really do want to be proactive about this. So definitely reach out, let us know what you need. And for those of you who are still thinking about your questions, do feel free to reach out and let us know your questions. And I just want to make sure folks are aware, we have some resources shared for you all here. We've got the CoC 101 recording that's available, the recording and the slide deck. If you are interested, if you missed the information session, but would like to get that information for yourself or your staff or folks you know. Reminder of how to schedule an appointment at TCF for vaccinations. Hannah also talked about this in her section. Reminder of the flyers. And we have some information too for you guys about the stimulus payments that are available, helping clients to get their stimulus checks, and then tax prep options that are available as well. I would love for us to have time to talk about it this go round, but recognizing it's 10:06, I want to let you guys get on with the rest of your day. So there's information on these slides. If you have questions about any of the resources that are listed here, feel free to email. If I don't have the answers, I can work to get them for you. So with that, I just want to say thank you guys. We really appreciate all of you. We appreciate you taking the time to meet with us today. And we do hope you'll reach out and let us know what you need. All right. Thanks, everyone. We appreciate you. Have a great rest of your Friday and a good weekend.